Thanks, Chris. We appreciate that. Before I introduce myself, I'd like to Dr. Lisa Ingarfield to introduce herself.
All right. Well, hi, Dr. Lisa Ingarfield. I was the research partner on this project for Commerce City and Brighton Police Departments. And I do a lot of research and evaluation in the nonprofit criminal justice sexual violence field. So I'm excited to be here today and share what we learned.
Great. Thanks, Lisa. And my name is Kim Messina. I'm the Victim Services Manager for the Brighton and Commerce City Police Department Victim Services Unit. I was also the project director on this project. We're really excited to be able to share our project and kind of let you know what we learned and hopefully help in the success of your project. So Chris, let's go to the first slide. Great. So Brighton and Commerce City is a community that is nestled up to the Denver metro area. Commerce City is actually right on the border of Denver, and then then Brighton, sorry about that. And then Brighton is located right outside Commerce City. So we share a border. Combined, we have 196 sworn officers and a population a little bit over 106,000. As I mentioned, we had adjacent jurisdictions, and we currently, and before we started the SPI project, we had shared programs and shared units. So we really felt like addressing sex assault would be a great option for us. We had combined units such as victim services, which merged in 2014. We have a combined SWAT team, as well as we participate in the North Metro Drug Task Force, which is made up of over 13 agencies. So really the model fit the need of what we were looking to accomplish. Both cities conducted internal and external audits on their sexual assault responses. Brighton did a more informal kind of look into their cases and found that we just weren't doing the right things for the right reasons, and we weren't serving victims well, and we weren't getting to the conclusion and serving our community the way we wanted to. In Commerce City, it was a little bit more in depth. The audit was an external audit where we brought professionals in and we reviewed all of our cases, and we looked at victims' experiences. We looked at how our CSIs handled cases. We looked at investigations as well as patrol. And what we found is that we were really lacking in our response. Part of what brought on the audit as well is that when Brighton and Commerce City merged victim services units, there was a huge discrepancy in the way victims were being treated. And so the result of the audit really catapulted some of this model, as well as both cities had implemented the You Have Options program. Some of you may have heard of the You Have Options program. It's a program that initiated out of Ashland, Oregon by a detective by the name of Carrie Hall. And the You Have Options programs allows victims many accesses to the criminal justice process to report a sex assault in the way that works best for them. So there's like online reporting, there's anonymous reporting, and they're really in control of the investigation. So because we had so many collaborative efforts and both agencies knew that we could do better in sex assault, that's kind of how we came together. Next slide. So when we looked at the model in which we were wanting to address for the task force, we wanted to do something cross-jurisdictional so that we could pool our resources together. Sex assault we knew was an ongoing issue, and it also required specialized attention and specialized training. As we knew from the research, not only that we did through the implementation of the audits, we also worked with a researcher from Denver University. She was a student, or CU Denver, who helped put together additional resources and information that demonstrated that trauma-informed responses keeps victims engaged by having active victim services, trained detectives, is more likely that the survivor is going to continue or engage first of all, and then continue to stay involved. So the task force really wanted to look at how can we bring a group of people together that are specialized in this investigating sex assault and can take victims to a place where they feel comfortable. So neither city had the resources to implement a sex crimes unit. As I mentioned, our population is 106,000. And so our investigations in Commerce City is 14 detectives and Brighton's was 6. So no one had the resources to be able to dedicate a sex crimes unit. So the decision was made to pilot this cross-jurisdictional project. And the idea also came from just having a conversation around the table with outside influences that said, like, why are we doing this on our own? Like, it makes more sense that we would work together. We also provided specialized training and integrated not only victim services into the unit, but we also had a district attorney representative, which we'll talk about in terms of key collaborations and partnerships. It was really important that because we all work on sex assault together and no one agency can meet all of the needs of victims, that we needed to have these key partners. And so we brought in our district attorney's office. We had local counseling agencies, our medical forensic nurses, such as our SANE programs. We also had our 17th Judicial District Sex Assault Response Team Coordinator, as well as the child welfare agencies. And one of the really cool approaches that we had with bringing all these collaborators together is that everybody met weekly and still do meet weekly to talk about these cases and how can we provide wraparound services to victims and keeping them engaged. Next.
All right. I want to apologize. I have a puppy that is currently barking at someone out the window, so I don't know if you can hear it in the background. So obviously a key component of the SPI program is that the work that we're piloting is evaluated to determine its efficacy and to know whether or not what we have implemented is working, right? So it's a great landscape and opportunity to test out new ideas. So we conducted kind of a multifaceted evaluation. As we thought about how we wanted to address this, we rested on case review as being our primary mode of evaluation. So as Kim had mentioned, she had previously done 2 case reviews at both of the agencies that helped determine the need for the task force. And so we decided to stay with that process for the task force itself. So what we ended up doing was evaluating 50% of the cases prior to the implementation of the task force and 50% of cases after the implementation of the task force. So to do that, we developed a rubric. So based on best practices in sex assault investigation nationally, a number of research endeavors from IACP and PERF and other agencies that have expertise in this area, we created a rubric that had multiple sections. So a section for detectives, a section for victim advocates, a section for documentation and the way that the case was put together. And then we used that rubric to score all of these cases before and after the implementation of the project. So I think we did 564 cases all in all was what we reviewed. And there were 3 of us doing the reviews, myself, Kim, and then a sergeant. And there were at least 2 people reviewing each case. So that was a very big lift. It was a bigger lift than we anticipated, but it really helped us identify whether or not the sex assault task force was actually having an impact on the quality of investigations that were happening. So to supplement that case review process, we also did qualitative interviews to document the implementation. So I sat down with folks who were connected to the task force, detectives, the chiefs of police, victim advocates, the DA's office, a number of people. I did that every 6 months to understand how the implementation of the task force was going, ideas people had around how things could be implemented differently, levels of stress, those kinds of things, so that we would be able to make some recommendations should other agencies want to implement something similar. So we felt that that was a really important piece to do. And then additionally, I tracked cases. So all the cases that came into the sex assault task force, I worked with the sergeant to track how those cases were moving through the system. So were they inactivated? Did they get presented to the DA's office? If they went to the DA's office, did they accept the case and file charges? If they did, what happened to the case? So I regularly was meeting with the district attorney to go over the cases that had moved through their system to find out what the outcomes were. So that was quite a fiddly process because there's not a lot of interconnected communication or data tracking that happens at law enforcement and at the DA's office, at least in the jurisdictions we were working in. And so it was a question of getting information from the sergeant of the task force and then cross-referencing that with the DAs. And then whenever there was a discrepancy, which happened quite a lot, trying to figure out what actually happened to that case. So the case tracking piece was important because it enabled us to understand whether or not more cases were being filed after the implementation of the task force, if the number of inactivated cases had gone down or up, and if it had gone up, why, right? Because part of the You Have Options program, as Kim articulated, is to let the survivor lead that process. And so that can often lead to a higher level of inactivated cases. But that's not because the detectives aren't doing the work. That's because they're following the lead of the survivor, right? So we wanted to document all of that. All right, next slide. Okay, so some of the outcomes and successes that we had with this project were pretty significant. And the first one was in relation to Child Protective Services. So we had, predating my involvement in the case, the relationship between Child Protective Services and police departments in these jurisdictions was rocky. And so there's a lot of history there that I'm not privy to, but because Child Protective Services ended up being a part of the task force and attending weekly meetings, it was extremely helpful in terms of resetting that relationship. And now I think it's fair to say, and Kim, you can, jump in here if you want, that it's a very strong relationship between Child Protective Services and the Sex Assault Task Force. In terms of the collaboration, the communication, making sure they're working together for the best interests of the child. They each are able, they know people in each department, right? Which makes a huge difference. So they can make those calls really quickly and get problems resolved. So that was a pretty huge success and outcome for us. The other piece was, one of the goals, we wanted to really embed a trauma-informed, victim-centered approach to policing, in particular to policing and investigating sex crimes. And that was achieved because every detective went through training around trauma and around interviewing victims of trauma. And obviously we had the embedded victim services unit in there. So I would say that in terms of creating a foundation in that unit related to trauma-informed victim-centered work, we were able to do that. Now, the case scores did rise once the task force was implemented. So I was able to plot all of those 564 cases over time. And so we did see those scores trend upwards. Commerce City had the most change based on their scores. So they really jumped quite significantly in terms of the scores once the task force was implemented, but they had further to go. So that's not Lisa's opinion. That's the opinion of the commander at Commerce City, who felt that they weren't in as good a place as Brighton. So their improvement was more noticeable. So we were able to do that analysis and find that there was some change in a positive direction. The other piece that we found was that caseload progressively increased over the 3 years. So when the project was proposed and we submitted the grant to BJA, the staffing assessment was made based on kind of the current volume of sex crimes in both agencies at that point. But once the task force had been implemented and information about the task force got out into the communities in terms of service providers, the public, with the You Have Options programs, what we found was that the number of cases increased significantly. And so every year there was a very large ramping up of the number of cases, which left us at a point where we didn't have the infrastructure necessarily to handle that. So that was an outcome, not necessarily a success. It's a success in the sense of more individuals were coming forward and reporting their sex crimes. But it was certainly a learning point for us when we thought about how would we staff this differently if we could do it over again. And then having victim services embedded in the unit was fantastic. And a number of the detectives constantly praised the victim services team because they're right there working with the detectives. They're able to have a team approach and really center the needs of the victim versus being in different locations and the victim advocates having to work with victims, families of homicide victims and other issues. They were solely focused on sex crimes. And I think that made a huge difference. All right, next slide.
Sorry about that. I love it when we get to talk about the successes, but I think more importantly, it's to talk about what we learned in the insights that we took away, because what we took away from the project not only will help us make our project as it lives on stronger, but then also to be able to talk with you guys on things to look at. So one of the things that we recognized very quickly is that it took longer than anticipated to actually get the project up and running. We had it foundationally ready. However, our space took a little bit longer. Merging 3 IT infrastructures was like worse than a nightmare. And so kind of an additional planning ahead on some of those things that we just didn't anticipate. As mentioned, our IT infrastructure was a concern. And to be honest with you, it still kind of is. We're co-located in a building and it's in the Brighton jurisdiction. However, it's the Adams County government building. And so that's where the third infrastructure comes in. And so that can create barriers in terms of information sharing, access. I mean, when you're investigating sex crimes, there's so many like firewalls to get through and with some of that material. And so that was definitely a significant barrier for us. The pilot program really requires staff who's open-minded, eager, willing to learn and to be flexible. When we first thought of this project, we thought we would have the same core detectives that were hired the first day or came into the unit the first day as when the project ended. And we quickly found out that didn't happen. And some of it wasn't because they weren't flexible or willing to learn. It was that they were the persons in the agencies that were moving up. So we lost people to promotions, we lost people to other task force. And then we did lose some because they're like, this is a lot. And so really kind of looking at being able to manage new and in a new and fluid environment. Sometimes some of the detectives would feel isolated there because they weren't in their home agency. And then they were also responding to another agency that had a different culture. So blending those cultures was also something that we realized we potentially could have done a better job on the front end. The need for structured of onboarding new team members before they actually started taking cases, we realized was really important because we were taking on a new philosophy that no stone was going to be unturned with these sex assaults. And the additional collaboration, like sometimes the collaboration around the table was difficult because we were hearing things from different perspectives, different angles, and sometimes law enforcement doesn't like to hear that. So really kind of managing that, onboarding expectations, onboarding that this was a pilot project and that we were working with a researcher and what our intended outcomes were to be. The other lesson that we learned is we really needed strong supervision and the need for mentorship. We did have some significant turnover in sergeants. I think throughout the program, we had a total of 4 sergeants. And so that's a difficult thing to maneuver or change. And then ultimately understaffed. The cases by year continued to go up. And even though we had the initial staffing, I think by year 3, we had such an increase in cases that the workload was just really too high. And so building that out a little bit more and managing that. And then the need for an embedded mental health program. CNA was so great. We tried to get this off the ground so many times about doing an officer wellness. And unfortunately, we weren't able to get it off the ground during that time. We had the research tells us that investigators who look at these images and who do this work have a much more likelihood of PTSD and other issues in regards to this work. And so officer wellness was a really important thing that we definitely struggled with. Next.
Okay, so, my role as the researcher embedded in this program was important, I think, in terms of building trust. So I attended most of the weekly meetings where the task force members and community partners came. I also had regular contact with Kim, the project director. So we met either every week or every 2 weeks to make sure that we were on track. And then any report that was required of the project, both in terms of sharing with the community what the task force had been doing, but also back with BJA and CNA, was a collaborative process. So ensuring that voices of the task force themselves and the agency leadership were involved in editing, writing, and putting those reports together so folks felt like that they were included. And that was a really important piece of my role in terms of facilitating those connections. Overall advice, I think, and Kim, please do jump in here since this is the last slide. I would say that with these projects, you have to be flexible. You're going to go in with a prescribed plan, right? Something that you wrote in your application, in your grant, but it may not go that way, right? You might find that you have to pivot and go in a different direction because something isn't working how you thought, and that's okay. You have support, you have experts available to assist you if any changes are needed. And so connected to that, think about the continuous improvement model. So this is a concept from evaluation where you are implementing a new program, and as you implement, you learn what works and what doesn't. And so then you make improvements on the fly, right? So it's something that is a continuous process versus you implement the program for 3 years and then at the end you look back and go, oh, we should improve A, B, C, and D. The continuous improvement model encourages you to make those improvements as you go. So you're constantly learning and you're constantly navigating and adapting. And I think that is part of that flexibility that's needed for these pilot projects. Having clear expectations for staff, and Kim talked about that in the onboarding process. I think we were remiss in not creating more effectively some standards and expectations about what does it mean to be on the sex assault task force. It means that you don't know everything about sex crimes, right? It means that you're willing to work with victim advocates and that you understand that this is a research project. So people are, the research is going to be tracking what you're doing. And that's not because you're doing something wrong. That's just the nature of the project. And then making sure folks, there's an accountability process involved for folks who are not participating as perhaps they had said they would. And that's, the last bullet there is these are pilot projects. It's just not going to go to plan necessarily. Like I talked about with flexibility, and that folks who are engaged in the project with you, it's really important that they understand that. It's possible you have some perfectionists on your team, right? And this is probably not a great place for those folks if they're not going to be able to understand the bugs and barriers of implementing a pilot project. So, Kim, did you want to add any overall advice?
Yeah, I think one of the things I would say is you're going to have, or you have a great group of experts that are.
We got a national conference for SPI.
I see that Tom Woodsman and Brenda Bond. I don't see Brenda on here, but Tom Woodsman. They were great for us to bounce ideas off and talk with them and tell them what's going on. And they thought of things that we weren't thinking of. And so really taking that team approach. The other thing I would strongly, strongly encourage is if you're a site that doesn't have a researcher, I would really encourage you to find one, whether that's through college or another program. Because as Dr. Ingarfield mentioned, like we were able to pivot when we saw that things weren't working, and we were able to get real-time data on things that we may not have necessarily been thinking about. And to be able to have that was just, it was so great. So I would just say, be flexible, get yourself a researcher, and also rely on your CNA team. So it looks like we have like 2 minutes. Are there any questions? It looks like there's one question in the chat that says, was it necessary or difficult to adjust your research model because of the continuous improvement approach?
Not really. Initially, we had we were going to go one way, and then through discussions with CNA and the Dr. Brenda Bond, we decided to go a different way, but that was at the front end of the project. And because the rubric for the case review was developed from national best practices, if we needed to pivot in terms of implementation issues, it didn't really affect that piece of it because those variables, those measures weren't going to change because best practices nationally weren't changing, right? So it wasn't influencing that. But certainly, I would say that continuous improvement model was probably more, it was more affected around staffing, and we had sex offender management at one point, and so that definitely didn't go as planned. And so our continuous improvement model really affected how we engage with sex offender management. It was less on the research side that we saw those two intersect.
So Chris, we had a couple more questions in the chat. Can I try to address them super quick?
Yeah, please do. And I actually have one other question that I want to ask you as well.
Okay. So Cynthia asked, do you think collaboration helped to raise the prioritization in the investigation of sex crimes in police agencies more generally? It seems like that was a big challenge in many agencies at this starting point. Yes, I completely agree. Actually, before we even did the internal audit and as victim services was merging, it was actually our SARC coordinator who was gathering information, had shown very clearly that the Commerce City Police Department filed far less cases on adults than they did children. So those collaborations, although were kind of difficult, they were beneficial. And now we work so strongly with our SARC. Chris, did you have something?
Yeah, there was somebody from Anchorage asking, were there other projects working on similar issues such as your SPI at the same time? Our environment has a lot of stakeholders working on similar issues, and coordination with these partners would likely be quote unquote interesting.
So I think overall, it would be fair to say that before we started thinking about this project, Commerce City was doing a lot of different things because we had just engaged in collaborative reform. And most of that was around victim issues. And so there were other collaborative efforts occurring within the police department, which actually felt like a super heavy lift. However, we just knew that our sex assault was in dismay. So we had to take that approach. One thing I will say that we did was we brought in Dr. Chris Wilson to talk about the neurobiology of trauma. And that really helped in all areas of working on victims' crimes. And so it hit all of those, but we took the sex assault further.
Yeah, and I would just say an example perhaps that would be akin to what you're saying, Troy, is the sex assault response team in the 17th Judicial District, right, Kim? Because that's not our project, but they were a partner on our project. But the SART is a multidisciplinary team, law enforcement, medical, victim advocates, community partners, counseling, district attorneys, and they're all working on sex assault like independently, and then come together once a month to have discussions about how they can improve process and services collectively. So that's a lot of stakeholders, and it is also quote unquote interesting sometimes. So we interfaced with that group through the coordinator who came to the task force meetings, and it actually ended up being like a way to funnel information backwards and forwards. So not exactly what you're asking, but the SART is certainly probably a close representation of that.
Great, thank you. And then Kim, I just had a question for you all. We have a number of sites that are obviously either has partners or, different agencies maybe working together on a particular issue for their SPI. Did Commerce City and Brighton develop an MOU to kind of work together? How did some of the other partners play into a possible MOU? And then were there any data sharing challenges as you worked across different agencies or jurisdictions?
Boom, that's a big question. So we did not engage or write any MOUs other than the IGA to develop the task force between Brighton and Commerce City. So there were no formal MOUs. Each department, Brighton and Commerce City, currently has individual MOUs with our forensic interviewers at the Ralston House that does mostly children. So that one was already in place. As for Child Protective Services and our others, we did not engage in an MOU or our DE's office. We did not have challenges in regards to communication across jurisdictions because we were currently only working within Brighton and Commerce City. And those agencies that were at the table either had an interested client involved and or we wouldn't give that delicate information. So there was either an invested interest, but we did not have any MOUs.
Okay.
One thing I would add is there was and continues to be issues with evidence. If you think about evidence as data, right? So both police departments have to upload evidence, and it's required that the evidence for a particular crime in a certain jurisdiction has to be with that agency. So you have these two departments that are working collaboratively, and sometimes then the detective would have to upload the information twice to two different systems or have their colleague from the other department. So like if it's a Brighton detective in investigating a Commerce City crime and they couldn't get access to the Commerce City evidence repository, online repository, right, then they'd have to have a colleague update it or upload it. So there was data issues there, less around confidentiality and more around like the logistics of what does it mean to bring two departments together that have two systems. And then you've got these like city ordinances and state laws that require certain things. And we didn't think about that on the front end. And that continues to cause some issues in terms of efficiency and time.
Okay. In the interest of time, I'll give one more question for you all, and then we'll move to the Tempe presentation. What recommendations do you have to mitigate law enforcement turnover during a project or maybe fund positions?
So I wish I had that. That's $1 million question because unfortunately law enforcement is losing officers every day. Staffing is a huge issue. Through our SPI project, we funded detectives and 2 detectives and a sergeant as part of our project to increase the resources. We've thought about looking at funding more positions. The problem is having bodies to put in those positions. So unfortunately, I just don't have a great answer for that.
Yeah, I mean, I do think, Kim, one of the pieces might have been, like we've talked about a lot, if we'd done a better job of the onboarding and explaining the pilot project and the nature of an innovative practice is that we don't have all the answers. And so being open to learning, I think that might have helped, because there are a couple of folks who were a little skeptical of the research piece and didn't necessarily understand that the full scope of the project. So I think that might have helped, being really transparent about that. I mean, we thought we were transparent, but clearly we were not transparent enough. So I think whatever you can do to communicate the parameters of the project, that might help a little bit. But obviously those kind of like cultural national issues with policing, it's not going to affect that.
Great. Thank you both. I always appreciate the time and the insights you provide, especially for our new sites. If there's time at the end, we'll also circle back if there are any additional questions.